Imagine going to the doctor for your annual checkup, and instead of a human physician walking through the door, it's a smooth-voiced AI system with access to your full medical history, genetic data, and even your recent sleep patterns from your smartwatch. It doesn't check your pulse manually, doesn't ask where it hurts. It already knows. And when it's done, it gives you a diagnosis, a treatment plan, and a software update, not for itself, but for you. Sounds like science fiction? It's not. Welcome to the age of AI doctors, where your checkup might include an algorithm, a neural net, and yes, a firmware upgrade for your own body. This idea might sound wild or even a little dystopian at first, but peel back the layers, and you'll find this isn't some distant future dreamt up by Silicon Valley visionaries. It's already happening, in pieces. In fact, AI has been quietly infiltrating medicine for over a decade. It started with basic data analysis and image recognition, but now it's pushing the boundaries of what we define as a doctor. Let's start with a surprising fact. In 2020, an AI algorithm developed by Google Health outperformed radiologists in detecting breast cancer from mammograms. That's right. A machine did a better job at identifying one of the most common and deadly diseases among women than trained professionals. Not only was it more accurate, but it also reduced false positives and negatives. This isn't an isolated case. Algorithms are being trained to detect everything from skin cancer to diabetic retinopathy with incredible precision. But the real game changer isn't just in diagnostics. It's in personalization. Imagine a world where your health advice is not based on average statistics, but on you, your DNA, your microbiome, your wearable data, your mood logs, and even your voice tone over the last month. AI can aggregate this ocean of personal data and identify patterns that no human doctor could. It doesn't get tired. It doesn't forget. And it's always learning. It's not just a second opinion. It's potentially a better opinion. Take IBM's Watson, for example. Once the darling of AI healthcare, it was tasked with digesting millions of pages of medical literature, patient records, and clinical trials. Watson's goal? To provide oncologists with personalized treatment recommendations. It had mixed results, not because the AI wasn't smart, but because the human systems around it were slow to adapt. Hospitals weren't ready. Doctors didn't trust it, but the spark had been lit. Since then, dozens of AI systems have emerged that outperform doctors in specific tasks. In China, AI diagnostic tools are used in over 1,000 hospitals to quickly analyze CT scans for COVID-19. In India, AI is used to screen eyes for diabetic retinopathy in rural areas where ophthalmologists are rare. In the US, apps like Ada and Babylon offer symptom checking with astonishing accuracy. In Africa, AI-powered drones deliver medicine to remote areas guided by real-time health data maps. So what does this mean for the future of medicine? Is the family doctor going extinct? Not quite. In fact, AI might save doctors more than replace them. Currently, physicians spend nearly 50% of their time on paperwork and data entry. AI can automate much of this burden, freeing up doctors to do what humans are best at: empathy, ethical judgment, and nuanced decision-making. It's not about man versus machine. It's about collaboration. The AI is the scalpel. The doctor still holds it. Still, the idea of receiving a diagnosis from an emotionless algorithm can be unsettling. Can we trust a machine with life and death decisions? Can it understand pain, fear, or cultural nuance? And what happens when an AI doctor makes a mistake? These are real concerns. Trust in AI will require transparency, clear explanations of how decisions are made. That's why researchers are working on explainable AI, XAI systems, designed to show the logic behind their conclusions. It's not enough for AI to be right. It needs to explain why it's right, or at least why it thinks it is. And then there's the issue of bias. AI is only as good as the data it's trained on. If the data is skewed, say, underrepresenting minorities or women, the AI's decisions can be flawed, even dangerous. We've already seen cases where facial recognition tech performs poorly on darker skin tones. In medicine, a misdiagnosis due to biased data could be catastrophic. So while AI might make medicine faster, more precise, and more accessible, it also demands new ethical frameworks. Who's responsible when the AI gets it wrong? The software engineer? The hospital? The patient who trusted the diagnosis? Now let's zoom out and imagine the next 10, 20 years. Let's say you wake up with a headache. You speak to your virtual health assistant, a voice that lives in your home speaker or phone. It asks questions, analyzes your speech for emotional stress, runs your vitals from your smartwatch, and checks your last month of sleep patterns. Then it compares all that to millions of anonymized cases in its database. Within seconds, it gives you a diagnosis and treatment plan. Need a prescription? It sends it to your smart pill box, which confirms your identity with a retinal scan before releasing the exact dosage. Need a physical checkup? You walk into an AI-powered clinic, no appointment necessary. A robotic system scans your body, takes blood non-invasively using microfluidic sensors, and uploads your results to your cloud health file. An AI physician reads it in seconds. And maybe, just maybe, it also suggests a firmware update for your neural interface implant, so it can better track your dopamine levels next month. This might sound like sci-fi, but we're already building the foundation. Elon Musk's Neuralink is exploring brain-computer interfaces. Biohacking communities are developing DIY implants that track glucose, heart rate, and stress. And tech companies are investing billions into longevity, precision medicine, and digital therapeutics. The checkup of the future won't just detect illness. It will predict it, prevent it, and maybe even enhance your baseline health. Medicine will become proactive, not reactive. But here's the final twist. As AI becomes better at understanding our biology, it may also redefine what it means to be human. If we're constantly upgraded, constantly optimized by algorithms, do we become a kind of hybrid organism, part flesh, part data? In this future, your doctor's appointment might not just be about healing, it might be about evolving. So next time you visit your physician and they pull up a glowing screen with an AI-ass recommendation, don't be surprised. You might just be seeing the first step in humanity's transition from Homo sapiens to Homo digitalis. And when that day comes, the most important prescription might not be a pill, but a patch update. If this blew your mind or made you question the future of medicine, make sure to smash that like button, subscribe for more eye-opening content, and hit the bell icon so you don't miss what's coming next. Drop a comment if you'd trust an AI with your next checkup. We are reading them all.